Hello again, and thank you very much, everyone, for coming and joining us this evening. We are with Jesse Arreguin, the current mayor of Berkeley, who is, like people of Richmond, concerned about having a hospital in the area, a full-service hospital, because there were talks about Alta Bates shutting down. I'm going to let Jesse talk about it himself. Also, some of you may know that the city of Berkeley has done a great job in terms of increasing housing availability and addressing homelessness. So we are asking Jesse Arreguin to talk about those issues and other issues as well. And disclosure, Jesse is a candidate running for the state senate. I have endorsed Jesse because of the great work he has done. Yeah, Jesse, the floor is yours. Please introduce yourself, talk about yourself, what you've done, and everything. Thank you very much for joining us again.
Well, thank you so much, Sohaila, for inviting me, and thank you all for joining this evening, and thank you to those who are watching this recording as well. As Sohaila said, I'm Jesse Arreguin, the current mayor of the city of Berkeley. I've served as mayor of Berkeley for the past 7 years and on the Berkeley City Council for the past 15 years. And the issue of healthcare access is something I'm very concerned about and passionate about, and something I've done a great deal of work on during my time as mayor of Berkeley, not just to address the health needs and disparities in my community and help our city get through a global pandemic, but also to make sure that we can continue to have a full service hospital to serve Berkeley and the entire Interstate 80 corridor for years to come. With the closure of Doctors Hospital in Richmond in 2015, the only non-Kaiser hospital to serve a large part of northern Alameda County and West Contra Costa County is Alta Bates Hospital in the city of Berkeley. And in 2015, Sutter Health announced that they plan on closing Alta Bates in Berkeley by the year 2030. The state has required that full service hospitals have to meet seismic safety standards. That's something I'm sure we can all support. We want to make sure that our hospitals can withstand an earthquake and that patients and staff are in seismically safe facilities. But rather than invest in fixing Alta Bates to make it seismically safe so we can serve thousands of residents in the East Bay, Sutter Health announced that they intend to close Alta Bates Hospital and consolidate services at Summit Hospital in downtown Oakland. And to this day, Sutter Health has not submitted any permit application to expand facilities at Summit in downtown Oakland. They have provided very little information about their plans and how they're going to serve Berkeley and a large part of the East Bay if they do close Alta Bates Berkeley. And so there is a great deal of information we need to better understand what the healthcare impacts are going to be on our region. But since 2017, since I took office as mayor, I've led a regional task force of elected officials, emergency and public health providers, including Contra Costa County Public Health, Contra Costa County EMS, the mayor of Richmond, the mayor of El Cerrito, the mayor of San Pablo and Pinole, County Supervisor Joya, and leaders in Alameda County to study the impacts of the closure of Alta Bates and on our region's healthcare needs. And so to help inform and that conversation and to get more specific information on what the impacts of closing Alta Bates would be, we worked with UC Berkeley to commission a health impact assessment, which is a report that looked at what are the impacts of closure on serving the healthcare needs of a large part of the East Bay. And I want to provide just some information from that health impact assessment to kind of really frame this issue. So in terms of the impacts on emergency services, in 2017, Alta Bates saw over 50,000 emergency department visits, and that was a 21% increase from 2010. And at a time when we need to increase emergency department capacity, closure would reduce our region's capacity, leading to longer wait times for emergency care. And what this means is if the hospital closed, that all of our ambulances would be tied up and they would not be able to be dispatched to be able to respond to other calls for service. It's called wall times. The wall times would increase, and that would impact not just emergency services, but also impact the ability to timely serve people that are transported to hospitals. Berkeley and neighboring jurisdictions have limited number of ambulances. And so the closure of Alta Bates will result in ambulances having to travel further to transport patients to the nearest hospital. And the additional time needed to travel will not only reduce overall response times, but put people who either have had a heart attack or a very serious emergency at greater risk. And we know that minutes are critical in the event of an emergency. And just to put in context, we have Chevron Richmond, we have the East Bay Hills and the potential wildfire risk in the East Bay Hills. We have a major earthquake fault that goes through the city of Berkeley. And so there are a number of man-made and natural hazards, which make it even more important that we have a full-service acute care hospital open 24/7 to serve people immediately. And so the longer it takes to get somebody, to transport somebody to a hospital, or if you're stuck on I-80 trying to get to a hospital, that will put people's lives at risk. So this is a matter of health and safety, and we have to prioritize the safety of the people in the East Bay before the profits of Sutter Health. So, so that's just in terms of the impacts on emergency services, a little bit of context. And then also with respect to impacts on vulnerable populations, a majority of the patients at Alta Bates are people of color, and 41% of patients are uninsured or are Medi-Cal recipients. 23% of patients are over the age of 60, and 11% of the population within the hospital service area have a disability. So closure would result in an interruption of service to these groups, and we'll have more difficulty in accessing healthcare elsewhere. And we know that America is woefully behind other wealthy countries when it comes to maternal care, but Alta Bates has some of the best health outcomes when it comes to birthing services compared to regional and state averages. There are over 5,000 babies that are born a year. Some of your kids may have been born at Alta Bates Hospital in Berkeley. It has the moniker of the birthplace of the East Bay, and the closure of this hospital results in even higher maternal morbidity, especially for women of color. Berkeley also has, and many East Bay cities also have a aging population, with over 20% of the city's expected population to be over 65 by the end of the decade. We see similar trends throughout the region. So the closure of Alta Bates will reduce the number of acute care beds that are needed to meet the increasing number of hospitalized elders, impacting access to critical treatment. And we've seen over the past decade the number of patients coming in due to a mental health emergency. And nationwide, there's been a 44% increase in emergency department visits due to mental health or substance abuse between 2006 and 2014. And in 2016, 4% of the emergency department patients in Alta Bates were transferred to psychiatric care. I also know on a firsthand basis, having visited Alta Bates, that oftentimes people who are experiencing homelessness end up at Alta Bates either due to a emergency or mental health issue. And they do a great deal of work of referring people who are experiencing homelessness to housing resources and other social services. So it also is a lifeline as well. So the closure of Alta Bates could result in an increase of people who are not getting critical care. And really our emergency departments serve as a front line for assessing mental health and public health needs. And so this will be a big gap in our ability to serve vulnerable populations. Like I said, there are a number of natural and man-made disasters where we need to have a full service hospital. And then more specifically, to put in context with COVID. So we have just come out of an emergency over the past 3 years, and we've seen how critical having hospitals are during this pandemic. And at its peak during the pandemic, over 450 hospital beds were occupied by COVID patients in Alameda County. Even today, Alameda County sees 18 new hospitalizations a day and 65 hospital beds are occupied daily by people who have COVID-19. And if we're not for Alta Bates, many people would have died due to COVID-19. They would not have gotten the emergency care that they needed. And so imagine what would happen if there was another global pandemic or some other serious emergency that puts people's lives at risk. And during the pandemic, our hospitals were critical frontline responders and partners with our counties and with our cities in addressing our pandemic. And once again, a huge gap that would impact the health and safety of people in our region. So what is our strategy? So as I said, we've been working in coalition with elected officials from throughout the region since 2017. We've been working in coalition with our labor unions, California Nurses Association, SEIU, United Healthcare West, to put pressure on Sutter Health to keep Alta Bates Hospital open in Berkeley. We pursued state legislation to give the Attorney General more power over hospital closures. And unfortunately, that legislation was not signed by Governor Brown, but we believe that it should be reintroduced to give our Attorney General more power to decide whether the closure of a hospital would significantly impact healthcare access in a particular area. Also, there's been attempts to extend the timeline for when that seismic work needs to happen for an additional 3 years after 2030, because the pandemic disrupted a lot of plans for hospitals to be able to do the seismic upgrades needed. That legislation may come back at some point as well. I just have to say, it is fundamental that Berkeley and West Contra Costa have a full service hospital. While we need to continue to lobby Sutter Health to invest in their current site in Berkeley, we're also looking at where a new hospital could be located to best serve the region. And so in those discussions, we have explored a number of sites in West Contra Costa County, including in the city of Richmond. The Richmond Field Station, which is owned by UC Berkeley, is one site. UC Berkeley is deeply concerned about the closure of Alta Bates because that's the only hospital that serves the students and the faculty and staff on the Berkeley campus. And then there have been discussions around maybe the Hilltop Mall District, where there's a major planning process underway by the city of Richmond, could be a location that could accommodate on a portion of its site a hospital as well. And we are in communication with a variety of healthcare providers to explore the potential of their interest in wanting to locate services in West Contra Costa County as well. So there is great potential to locate a new hospital either in Berkeley or Richmond to serve our region. And I'm committed to working with West County leaders like Councilmember Bana and others to get this done. So your support of our campaign for a full service hospital to serve Berkeley and West Contra Costa County is critical. And we will be in touch with you through Councilor Bana about ways for you all to get involved in this public campaign to call for the keeping Alta Bates open in the city of Berkeley and for making sure we have critical healthcare access to serve our region. So once again, this is an issue of life and death. This is an issue of public safety, and we all have to work together as a region to address this issue. So that's just a little bit about that particular campaign. And Sohaila, should we open up for questions about Alta Bates before we dive into homelessness? Would that make sense?
That's a good idea. I have a couple of questions myself, and I should
Great.
say my son was born in Alta Bates,
Great.
but though we definitely people in Richmond would prefer to have a hospital closer
Yes.
to our area. Are there any questions at this point about the hospital timeline, anything? Okay, I would like to ask my questions if others don't. So our mayor is currently involved in the task force, is that correct?
Yes, absolutely.
Okay, excellent. And is there a timeline for resolution or progress?
Well, so we have 7 years, because that's when Sutter Health said they're going to close Alta Bates, to figure something out. And based on my consultation with healthcare providers and healthcare finance experts, doing a hospital project is really expensive and it takes a lot of planning. And so I think this next year is going to be critical to have some plan for doing something, whether it's getting them to commit to invest in Alta Bates and working in partnership with them to help support that effort, or whether it's going to be some other hospital in the region. So I would say just give them the lead time and the fact we have the 7 year timeline where we got to get something in place before then, I think this next year is absolutely going to be critical for us to have resolution. And I'm hoping that we can have something, some plan that we can announce in the next year.
Excellent. And so are there any talks with Prologis, who has purchased the property of Hilltop, or with the city of Richmond?
Yeah,
specifically
there
about
have been
this?
conversations with both the city of Richmond, with your colleague Cesar Zepeda, who represents the Hilltop district on the Richmond City Council, and with representatives of Prologis as well, around the idea as part of that big master plan, the rezoning effort that's underway for that site, whether there could be a site dedicated for a full service hospital. And it may be that we have more than one full service hospital serving God forbid, we should have more than one hospital serving Richmond and the East Bay. And it may be that we find a way to keep healthcare services going in Berkeley in some way, and we do something in Richmond also. I think that would be the best resolution potentially of this issue.
Excellent. And there's a question from Mickey. Are there state funds available for a hospital, or will it require a new tax of some sort?
Absolutely. There's a state agency called the state, I think it's State Hospital Financing Authority, where nonprofit hospitals can actually get financing for projects. And Sutter Health has actually, in recent years, got state funding, bond funding, to be able to assist in their projects throughout the state of California. And we've been very clear to Sutter Health, and I've met with the CEO of Sutter Health, I've met with the regional leadership of Sutter Health, that as far as we're concerned in Berkeley, we're willing to talk about zoning, we're willing to talk about funding, we're willing to be a partner working with them to try to solve this problem creatively and proactively, but we haven't gotten the same level of commitment on the other side of the table. So I think that's where we got to use the levers of not just of law, but also we have to build greater public awareness and pressure, because I think some of us are some of us may be Sutter Health patients. They may be our healthcare provider. And I think the more people that either access Sutter Health services, the more community residents and leaders that speak out, the more we can really emphasize that this is an issue of regional importance, and that they have to take this issue seriously and work with us to find a resolution.
So please educate us. Is it because Alta Bates is owned by Sutter Health that Sutter Health is a major stakeholder in finding a solution?
Yeah.
Or they are the major, stakeholder in the region, period?
Well, they're definitely one of the main healthcare providers in the region, but they own and operate Alta Bates and the Herrick Hospital in Berkeley as well. And I think it was in the late 90s, early 2000s, when Alta Bates Summit was bought by Sutter Health, that Sutter Health made a very explicit commitment in writing that when they did the consolidation, the monopolization of the healthcare services in Berkeley, that they promised that they were going to keep the hospital going, that they were going to make the investment to improve facilities to serve patients. None of that ever happened. It was a broken promise. And so now we need to hold them accountable to the promises that they made, the people of the East Bay. And it's going to take a community effort, everyone working together to help solve this problem.
Last question I have for you is, have there been any estimate or evaluation of the cost for seismic retrofit of Alta Bates versus building a new hospital?
Yes.
What are the numbers if you have them?
The challenge is that Sutter Health has not been very transparent around their analysis of the cost and work involved with doing the retrofit. Pre-pandemic, I met with the sort of facility staff at Sutter Health East Bay, who kind of walked through their analysis of what would be involved. And their conclusion was that it would actually cost more to retrofit the hospital in Berkeley than it would to build a new hospital. So I said, okay, well, let's build a new hospital then. What would it take to build a new hospital tower in the city of Berkeley? And we've been very clear that we're willing to look at creating a healthcare financing district, which is a legal mechanism to allow residents to tax themselves to help support the operations and construction of a hospital. We're willing to look at, is there something we can do with the state? What can we do to help solve this problem? And we're going to continue to iterate and look at maybe zoning could be an incentive or disincentive for closure. Because, if they close, they're going to want to use that land for its highest and best use. But if we zone it for hospital use, perhaps that may be a lever that we can also use as well. So, that's one of the things we can do as local elected officials, is use the levers of our land use authority to help effectuate the kinds of outcomes that we want. So I see, do residents in Richmond, El Cerrito,
El Sobrante.
And El Cerrito too, and
Yes,
El Sobrante have emergency access to Kaiser Hospital if we aren't members. You can go to a Kaiser hospital even if you're a Medi-Cal patient. But I think one of the issues, and Kaiser had really addressed this really pre-pandemic, is it's not big enough. It's not big enough to absorb all the people that went to doctors or that may go to Alta Bates. And imagine doctors closing, Alta Bates closes, and all we have is Kaiser Richmond. They absolutely cannot absorb that many number of patients. They're not enough doctors, the facilities aren't big enough. And so that's a whole nother issue we're gonna have to address, working with Kaiser as well, is what is the regional impact if there was a closure, and how can we support their ability to accommodate the healthcare need as well? And we don't have an answer to that question yet. So these are some very serious, big and important questions that we have to answer. We don't have answers yet, and we're having those conversations. Supervisor Joy has been a great partner working with us on this. He's very committed to trying to find a solution as well.
Excellent. Thank you very much. Really appreciate it. Any more questions about the hospital? Okay, I assume not. You may proceed to the next topic, please.
Great. Well, I'm happy to talk about homelessness, which is an issue I'm very passionate about. One, particularly because at one point in my life, I briefly experienced homelessness as a child. And we have so many people in our communities who are either living on the streets, living in vehicles, or having temporary and non-permanent housing options. And I really think that this is a reflection of the broader income inequality in our state and region, as well as the significant shortage of available and affordable housing. And we got to solve those two things while we're also dealing with the immediate impacts of resolving homelessness as well. So I'm gonna, am I able to share screen, Sohaila?
Just a second. Yes, you are now.
Okay. So I just want to pull up a chart. So, and can you see this?
Yes.
So this is a graph. This is on my website, jessearreguin.com. We'll put the link in the chat. That we have on the homelessness crisis. And this chart shows our point in time count, which is at every 2-year count that we do. We physically go out and count the number of people who are experiencing homelessness, either on the streets or accessing social services. And this just shows just the progression of the homeless crisis, not just in Berkeley, but in Alameda County. So, in 2015, as you can see, we had roughly 4,000 people. That number is now increased by, significantly. We saw to a 39% increase in 2017, a 43% increase in 2019, and then a 22% increase in 2022. We have roughly close to 10,000 people on any given night who are unhoused on Alameda County streets. In Berkeley specifically, we've also seen that number increase as well, from 834 people we counted in 2015 to now over 1,000. But I think an interesting statistic I want to highlight to really frame what I want to talk about is, while the county saw a 22% increase in homelessness, Berkeley saw a 5% decrease. How do we do that? How do we do that? So that's what I want to talk about. So key to that is making homelessness a key priority of our city government. And when I took office in 2017, I said that addressing homelessness is my #1 priority. Obviously, since then, there have been other things that have come up as well, like how we manage COVID and our housing crisis, public safety crisis. And the first act in office that I took in office was to activate our emergency operations center, which is our emergency apparatus of the city, to focus on expanding inclement shelter during the winter months. And so we have more shelter beds for people during the winter, and to help open longer term year-round shelter for people experiencing homelessness. And so we moved rapidly to expand winter shelter and also to expand shelter capacity in Berkeley. We also convene all of our homeless service providers to improve collaboration and coordination. And we have a bi-weekly meeting where we collaborate and go through a list of people who are prioritized for permanent supportive housing to talk about their needs and how we can prioritize them for housing. And then we launched the Pathways Project, which was really kind of a comprehensive plan for how we wanted to address homelessness in Berkeley. This is modeled after best practices in California, and the United States. And the goal was to create an unbroken path from the streets into permanent housing. And there were three components to the Pathways Project. One, we opened the East Bay's first navigation center, the STAIR Center, which is located at Cedar and 2nd Street in West Berkeley. And we took an abandoned city block and using modular units, created a low barrier shelter. And what we mean by low barrier is that people can bring their possessions, they can bring their pets, and they can bring their partners, they can live together. And those are some of the barriers that we encounter often for people to live in congregate and non-congregate shelter. We have laundry, showers, restroom facilities, community space and services provided on site. And we have what are called enhanced housing navigation services, meaning a social worker works with each person on an individual basis to get them prioritized, to get benefits, to get them ready into permanent housing. Through this navigation center, we have successfully rehoused hundreds of households through this program. The other aspect, and we're still working on this now, is to create a transitional housing village using what are called pallet shelters to provide individual housing for people. And we're working to implement that right now. And then we launched a homeless outreach team and a homeward bound program. The homeless outreach team goes out to street encampments and assesses people's needs and connects them to housing and social service resources. And our homeward bound program is intended on trying to reunite people who may be separated from family or friends, and to help address their travel costs and transition costs specifically. We also worked on how we could better improve coordination with Alameda County and with cities as well. Unfortunately, Alameda County, who controls all the social service dollars and mental health dollars, they were off doing their thing. While we on the ground, we're dealing with the issue in our communities, and we wanted to better braid resources and improve coordination. And so as the president of the Alameda County Mayor's Conference, I helped pull together a multi-jurisdictional task force of mayors and county officials to look at how we can work together to address homelessness. And now through the new Alameda County Home Together plan, we're working to require city and county collaboration in how the county spends its homeless dollars. And we're working on trying to coordinate our policies between the county and the cities, how we respond to homeless encampments. But really what's been key to all that Berkeley's done, and we spend roughly $30 million annually on direct services to address homelessness, more than any city in Alameda County. And that's because our community cares deeply about addressing the crisis of homelessness and addressing it effectively and addressing it compassionately. But key to our ability to solve this problem effectively was Measure P. 2018, I authored and we passed the Berkeley ballot box, an increase in our transfer tax, which is the tax you pay when you sell your home, a modest 1.5% increase in our transfer tax for the highest value properties over $1.5 million. And that tax is still collected for services to address homelessness. And so through Measure P, we've been able to fund a variety of programs. We bought properties to provide temporary and long-term housing. We've provided housing subsidies. We launched a street medicine team. We've expanded emergency shelter. We provide drop-in centers for people to access services, do laundry, store belongings. And we're launching a new trust clinic, which is going to be a primary care clinic in partnership with Lifelong Medical Care. We know provide services in Richmond also, to provide free primary healthcare services and drop-in services for unhoused and low-income people. That's going to open at the corner of 6th and University very soon. We've also significantly expanded our shelter capacity using Measure P. One project that we launched is called the Horizon Transitional Housing Village, and that was providing short-term shelter. We literally had we leased a warehouse that now is going through redevelopment, and literally provided tents for people to live indoors. We provided wraparound services for people at that site. And we also used the parking lot to provide safe parking for people living in vehicles. And that's a model we hope to replicate in other places. We funded and we opened the Berkeley Way Hope Center, which is the largest permanent supportive housing project in the city's history, over 140 units of affordable housing, which include affordable housing units, emergency shelter, permanent supportive housing, and services on site. It's really a vertically integrated solution to addressing the housing crisis for people experiencing homelessness. And we'd be happy to work with some of you if you're interested in organizing a tour of that facility. It's really a very visionary project. We are participating in the state home key program with 2 projects, which is they provided tens of millions of dollars for us to be able to buy existing hotels and to convert them into permanent housing. We are focused on homelessness prevention. Key to stemming the tide of homelessness to make sure new people do not become homeless. And so we have been focused through providing emergency grants to people who are facing housing insecurity and eviction to keep them stably housed. We have flexible housing funds to help keep people stably housed. And like I said, we funded a homeless response team that deals with encampments throughout the city. We're looking at how we can expand the amount of permanent supportive housing and extremely low-income housing and new housing projects that are built. And lastly, we're working to address dangerous encampments. So what we see either in Berkeley, Oakland, or Richmond, we see large encampments. I do not believe that living in a tent or living on the street is a healthy or acceptable solution. That while homelessness is a reality, that our goal must be getting people connected to permanent housing. That's the solution. It's called homelessness. So we need to provide the housing for people. And that's been a key focus of the work we've done in Berkeley is housing first. How are we connecting people to permanent housing? So our homeless response team, which I talked about, has reached out to hundreds of people on the street. And we have a roughly 43% success rate in getting people into temporary and permanent housing. Unfortunately, some people aren't ready, and we keep at it. We keep building trust and trying to connect people to temporary and permanent housing. But with respect to how we've dealt with dangerous encampments, we have our homeless response team. We established a policy to limit the square footage that certain objects can take up public sidewalks, not with the goal of criminalizing, but with making sure that our sidewalks are accessible for all people, people with disabilities, families. And we've combined that with not just shelter offers, but also places for people to store their belongings. And we are in full compliance with federal law, which requires that before any encampment resolution, we must provide either shelter or housing for people. As a result of our work through our homeless response team, we've been able to provide short-term housing and housing navigation to hundreds of people to successfully get them off the streets into permanent housing. We've also worked with the state to close and to successfully resolve a very longstanding problematic encampment that some of you may have seen at the intersection of University and Interstate 80, right there by the Berkeley Marina. And I literally worked with Governor Newsom and his staff, with state agencies, with Caltrans, and with the County of Alameda to come up with a plan to get people out a very dangerous part of the state right of way into short-term and permanent housing. We were able to get state funding to lease a hotel to provide short-term housing while we closed and cleaned a very dangerous visible encampment. And the collaboration that we fostered in Berkeley to resolve that one encampment inspired the governor to create the statewide Encampment Resolution Fund, which now provides grants to cities like Richmond to help address and resolve homelessness encampments effectively. And one thing that was very clear in the work we've done around closing encampments is that in order to connect people to permanent housing under state and federal law, they have to be screened and prioritized in a system called coordinated entry. And so one of the barriers that we saw is that people who were living in encampments but may not be a senior citizen or may not be severely disabled, they were not able to get prioritized for housing through coordinated entry, even if we had housing. So I worked with our assembly, we worked with our assembly member Buffy Wicks and the Bay Area Council on legislation that was just signed by the governor, Assembly Bill 1285, which will better connect and prioritize encampment residents into permanent housing through our coordinated entry system. So we hope that will be an improvement. So Berkeley is really doubling down on our commitment to compassionately and effectively address homelessness. We are a small city, but we're punching well above our weight in addressing this crisis. And we hope that some of what we've done could inspire other action by other cities. Ultimately, this is a regional issue. This is a statewide issue. It's a federal issue. And oftentimes it's up to individual cities to have to solve this problem alone. And I really believe that having strong partnerships with the state, and I want to commend our assembly member and our governor and our senator for their support of state resources to help us address homelessness on the ground. And we all need to work together in terms of coordinating our policies, coordinating our resources. I think with all that, we can make a real impact. And while we have to solve this problem to address the immediate impact of street homelessness, we need to build more housing, and we need to deal with the larger wealth sort of income inequality crisis in the state and in this region as well. So I'll stop there. There's a lot, but I'm very proud of what we've done in Berkeley, and we're always available to provide more information or to work in partnership with anyone who's interested in learning more about these specific programs.
Thank you very much for all the information and also for your great leadership on this very important issue. It just shows that there is hope. And so some people have given up hope actually on the issue, but I'm glad to hear that it can be addressed successfully.
Yeah.
And I have some questions for you, but first I'd like to see if any community members have any questions. Anyone? Okay, then I start with my questions. First of all, the low barrier shelter is an awesome idea, because when I talk to people, Pam, let me finish, then you're next. Thank you. They say that they don't want to go into shelter because they cannot take their dog. They don't want to let go of their vehicle, and we cannot find a parking place for their cars. So it's awesome. What's the address? And I would like, actually, we are going to have a town hall on homelessness. Pam may want to talk about it. And we would like to have a tour of that area.
Great.
I'd like to be in touch with, I would like to put the city of Richmond staff who are working on the issue with their counterparts in the city of Berkeley.
We'd be delighted to do that. We have a kind of a homeless point person, Peter Radu. He'd be happy to talk to anyone. The Stair Center is at 1601 2nd Street, at the intersection of 2nd and Cedar. And Bay Area Community Services, BACS, which I believe does provide some services for in West County and in Oakland. They are our service provider. They're the ones who run it. And happy to connect you or anyone who is interested in visiting and learning about the model. Yeah,
I'd love to do that. We need to collaborate. Let's do it via email. And I'm glad actually I saw Ilofis Sue, representative of Buffy Wicks here. I'll communicate with her about possibilities as well. It's been very educational and informative for me too. I knew bits of pieces, but as Marilyn says, thank you. Excellent layout of issues and solutions. Very, very exciting. Thank you. Pam, you go first, and we have other questions.
Okay. Mayor, I met you at the fundraiser.
Yes, good to see you.
And I want to acknowledge, I'm not an official, I'm just a citizen, but I've been spending about 2.5 years really studying this with a small group. We're an Alliance for Action on Homelessness and Fire Safety. We have about 150 hidden homeless in El Sobrani. We don't have them on the streets and in the encampments. There are 150 in a very high fire zone, very dangerous area. So we became very interested. And in the process of doing that, I I've been studying this for 2 years. I don't want to present myself like an expert, but I want to acknowledge you for everything you've done, for letting people have dogs, the low entry barriers for the shelters, for the understanding that, you know, people can't afford housing, even if they're not on drugs or mentally ill, they can't afford housing. So I really want to acknowledge what you've done. And we're having a town hall on Saturday. I hope you got an invitation.
I have not, but I would love to
Oh, it's so
hear
important.
more about it.
So Gila's going to be speaking there. Joya will be there.
Oh, great.
1 to 4, 12:30 to come and get refreshments. I will send you, maybe I can send it to Sohila and she can forward it to you. I know there's other people waiting to talk to you. I have so much to say. I've learned so much that goes even beyond all the amazing things you're doing. And I really want to be able to give you that information. And if you could come to the town hall, that's what we're doing, is we're talking about I'll just say this one sentence and then I'll stop because other people need to get on. At scale, meaning 300 with a 1,500 person planned permanent housing, proven success with the broken, the unfixable, the ones that are just never going to get a job, and they refine their humanity, so they don't just stay in some shelter broken on their drugs. They actually rediscover their humanity. And I, as a person that am just torn apart and disgusted when I see these people on the street, when I see them in Community First, I'm inspired by their humanity. I'm deeply touched by the journey they've taken to get back to being human without all of the trauma and the drugs. So I really want to share this with you because it's the extra piece that will take it over the top. And if you come on Saturday, that is what we're presenting. I hope you can make it.
I'd be happy to. Absolutely.
Oh, that is so fabulous. Thank you, Sohila. And thank you, Jesse. I'll just call you Jesse because
absolutely.
Thank you so much.
Okay, good idea, Pam. We can learn a lot from Jesse. I see that you're sharing your contact information.
Yes.
Do I have your permission to share it with the community when I share the recording?
Absolutely.
Okay,
Yes.
very good. Thank you. There is a question about the hospital, but before we get to the hospital, I have one more question for you. The coordination task force you mentioned between the mayors and county supervisors, was it just within Alameda or neighboring?
Just within Alameda County. But certainly interested in seeing how we can bring the counties together. I've had conversations with, I've talked to Mayor Butt in the past around this issue. I've talked to Mayor Martinez in Richmond about this issue. We've been in touch with Richmond council members around this, particularly because at one point we were looking at the potential of having a regional sort of what's called safe parking site or place for people to park RVs. And I know there's still some interest in, potentially looking at some sort of regional program. But there's the will, but we haven't identified the location. So absolutely, I think we're very interested in looking at how we can collaborate. We clearly have resources and we have the will, but I think working together, we can do some great things. So.
Excellent. Yes, it is a regional problem and requires a regional solution. So I'm already organizing, El Cerrito, Richmond, San Pablo, unincorporated El Sobrante to get together and evaluate the problem to come up with the solutions, hopefully, but learning from you and connecting would be awesome. Thank you. I appreciate it in advance. So if there are no more questions right now, I'd like to pose a question in the chat. How can we in the community help in saving Alta Bates or securing a new hospital?
Excellent question. So, well, if you are a Sutter patient, please contact Sutter Health and I can provide Sohila the information on the president. We are going to be launching in the coming month or two a regional public information campaign that's going to really be focused on framing the issue and why it's important that we have a full service hospital, and also to have a call to action. So there will be a very clear call to action, and we look forward to engaging you in that effort. But at the present time, we're encouraging people to contact Dave Clark, who's the CEO of Alta Bates Summit Medical Center, to let them know that you are concerned about this issue and call on them to do the right thing. And we're going to have postcards. We're going to have signs. We're going to have a whole public information campaign that we're rolling out soon all over the corridor, and look forward to working with you, engaging with you on it as well.
Excellent. Thank you. Yes, please share that contact information. I'll share it along with the link of this recording to the community members. I do have other questions, but we can talk offline about, how the city of Richmond can be connected and learn from your experience. I was taking notes, and I'm very excited about this, actually. All learning from what you shared. It's very exciting. Thank you very much for that. I know you have to leave and have another meeting. Are there any other questions for Jesse Arreguin, Mayor of Berkeley, before we let him go, either about homelessness or having a hospital in our region? Okay. Would you like to add anything at the end for the community members?
Just thank you for your time. It's going to take all of us working together to solve these problems. Not just government, but also our community. And these are serious issues, but I'm confident that we can find the solutions working together. And so once again, please reach out to me. My email is jarreguin@berkeleyca.gov. My phone number is 510-646-2852. Call me anytime, email me anytime. And I'm excited by the potential with Councilmember Bonna's leadership to look at how we can deepen the cross-county collaboration to address these issues. But I really thank you, Pam. Thank you to the residents who care deeply about this issue and who are trying to find research solutions. And we'll look forward to working with you together.
Thank you very much. And on behalf of the community, I would like to appreciate all the work you're doing for having a hospital in the region. It's very important for all of us. Thank you for your efforts and leadership. Thank you so much.
Thank you. Have a good evening, everyone.
Have a nice evening, everyone. Bye.